Probably one of the biggest areas that I see as a problem right now is the area of drug-induced microbiome disruption. People are on so many different kinds of medications, and yet we're also seeing all this research on a disrupted microbiome and how it impacts our health. About 24 to 25% of the medications on the market actually affect the microbiome. First of all, what does that mean to you? When your microbiome is disrupted, now the obvious thing could be like a diarrhea. Antibiotic therapy could do that. People that are on metformin, that actually can happen. Metformin, one of the darlings of the kind of anti-aging longevity movement. A lot of people got on metformin. Now it's not so popular because we found out that people that didn't need metformin, it actually made it harder to get muscle mass on. It inhibited muscle when you were training. But the bottom line is that, when you take metformin, there's about a third of people it will disrupt their microbiome. And of course, when the microbiome is disrupted, in addition to the obvious symptoms, gas, bloating, diarrhea, constipation, you start to affect the enteric nervous system. So the gut starts sending signals to the brain that there's a problem, and we start creating more chronic inflammatory signaling known as that metainflammation, which is what the Metabolic Code is all around. But other drugs, like the obvious ones are, you're on an antibiotic, statin medications, oral contraceptives, pain medications, some antidepressants. So there's a wide swatch of drugs that are commonly being used that can be disrupting your microbiome. Maybe on them for 8 months, maybe on them for a year. And all of a sudden you notice you're starting to have GI problems. So then you go to the GI doc, they have you taking medication for your GI complaint, when in reality, the medication that you started on, for whatever reason, that affects the microbiome, maybe you needed to take a probiotic and take some fiber, and you could neutralize that and not have the negative effect of that medication. When the microbiome shifts, probably one of the largest things that can affect everything from mood to inflammation to autoimmunity, to just GI health and GI distress, right? The gas, bloating, discomfort, distension that people feel. So if you're really interested in drug-induced microbiome disruptions, got a great link to an ebook on drug-induced microbiome disruption. Check it out. Get more in-depth information on it.